Ladies and gentlemen, please welcome the President of the American Academy of Nursing, Joanne Dish.
Good evening, ladies and gentlemen, and welcome to the American Academy of Nursing's 40th Annual Induction Ceremony and Celebration. I am Joanne Dish, and it is my honor to serve as the Academy's president for about 6 hours. I'd be honored all along, but tonight I'm joined with Diana Mason, the Academy's president-elect, who will lead the Academy starting next week. I wish her the very best of luck. Diana and I are pleased to host this evening's event. Nursing is a profession that is growing and becoming increasingly more important in healthcare worldwide. Our induction ceremony serves as a celebration of our profession. We honor a group of professionals whose achievements are distinguished, influential, and transform every aspect of healthcare around the world. By celebrating their work and welcoming them into the Academy, we secure the future of the Academy, strengthen nursing, and expand its ability to transform healthcare policy and practice through nursing knowledge, again, across the world. I'm so excited to see what wonderful things they will do as fellows. We are very pleased to have all of them being able to be inducted tonight. Because of the government shutdown, there was a possibility that some could not join us tonight, but we are thrilled to have all 172. I'd like to start this evening's celebration by recognizing this year's living legends. Within the Academy, we recognize a select group of Academy Fellows whose lifetime accomplishments are so distinguished as to render them legends in their own time, living legends. These are nurses whose actions and contributions will continue for years to come. On Thursday evening, I had the honor of announcing the 2013 Living Legends. If you please, I ask that each of the living legends stand when I call your name. Brigadier General Clara Adams Ender. Dr. Hattie Besant. Dr. Margaret Miles. And Dr. Jean Watson. This year, the Academy celebrates its 40th anniversary. That is 40 years of extraordinary leadership. That leadership has come not only from the people serving on the board of directors, but from all of our fellows who've given unselfishly of their time and talents to advocate for improving health care and promoting the health of individuals, families, and communities. Please join me to thank and pay tribute to several important groups within the Academy. First, our charter members. Those in the first cohort of fellows have guided the Academy since its beginning in 1973, 40 years ago. And if there are any here, please stand. We also have a number of our past presidents in the room, people who assumed the ultimate responsibility for driving the Academy and nursing to new heights during their tenures. I want to ask all of our charter members and past presidents to stand and receive our expression of thanks for your service and commitment. Thank you for your leadership. I also want to recognize a distinguished guest who has joined us and ask her to stand, and she is Dr. Judith Shamian, the President of the International Council of Nurses. Thank you. Before we recognize our new 2013 class of Academy Fellows, we must thank the members of the Academy's Fellows Selection Committee of 18 Fellows. Led by Lily Jelinas and Linda Scott, the selection committees reviewed thousands of applications to select 172 new fellows. Please join me to thank all of the members of the Fellow Selection Committee. Thank you. And now on to the focus of this part of the evening. In order to move through our induction in an efficient and dignified way, we ask that you limit your applause, not eliminate it, because this is an important event in your lives and their lives. But limit it and refrain from greeting the new fellows during the ceremony or after they leave this stage. We will be introducing the new fellows in groups according to their country or state and weaving in the introduction of our honorary fellows as well. I would also ask the inductees as they come up, if for some reason we have mispronounced your name, please let us know, because this is really important that we are saying it right to this whole crowd of well-wishers. And this is the one time you sure don't want your name mispronounced. So we've done everything we can to check the phonetics, but help us if we somehow get it wrong. So with that, our first fellow to be inducted tonight joins us from the state of Alabama, Rita Jablonski. Dr. Jablonski's contributions have led to reduced oral health disparities among persons with dementia. Her work, supported by many prominent foundations, focuses on reducing care-resistant behaviors during oral hygiene in persons with dementia. Her interprofessional approach includes research training for undergraduate and graduate students in nursing, psychology, and dental medicine. With this next inductee, we welcome you to the Academy. With our next inductee from the state of Alaska, the Academy now has fellows from all 50 states. Tina Davis DeLopp. Dr. DeLopp's work has expanded and diversified Alaska's healthcare workforce, including increasing opportunities for nurses. Through her efforts, the state doubled enrollments over a period of 2 years, graduated 100 Alaska Native and American Indian nurses, and attracted matching financial support for these initiatives from Alaska's healthcare industry. Welcome to the Academy. From the state of Arizona, Barbara Bagdasarian Brewer. Dr. Brewer is a nationally recognized nurse executive and researcher for her work on developing and measuring professional practice environments that have produced exceptional patient and staff outcomes. She is currently principal investigator of an innovative project that is setting up a national database for patient perceptions of caring behaviors of caregiver staff. We welcome you to the Academy. Mary Beth T. Gallagher. Dr. Gallagher pioneered an evidence-based interdisciplinary model of palliative and hospice dementia care that has positively affected thousands of patients and their caregivers, both here and abroad. For her work, she received the 2012 Outstanding Program Award from the International Journal of Palliative Nursing and the Program Manager of the Year by the Visiting Nurses Association of America. We are so pleased to have you join us in the Academy. Sharon Ann Pearson. Dr. Pearson is editor-in-chief of the Journal of the American Association of Nurse Practitioners and founding editor of Nurse Practitioner Forum. In 2012, Dr. Pearson was elected to the 15-member Governing Council of the Committee on Publications Ethics, which represents more than 8,000 journals and publishers around the world. Welcome to the Academy. Virginia Prendergast. Dr. Prendergast is the former president of the American Association of Neuroscience Nurses and leads the World Federation of Neuroscience Nurses, helping the Federation to double its membership to more than 7,000 nurses in 18 countries. Throughout her career as a nurse practitioner, she has shaped and elevated the work of neuroscience nurses. We are so pleased to have you join us in the Academy. Nelva B. Crawford Shearer. Dr. Shearer is a national leader in gerontological nursing research and practice. She developed a theory of health empowerment in which older adults are engaged as active participants in identifying and attaining their personally relevant health goals. Her work has had a profound influence on a generation of nurses. We welcome you to the Academy. From the Commonwealth of Australia, Leanne Aitken. Dr. Aitken has been a leading researcher on recovery after critical illness and injury. She is the representative of the World Federation of Critical Care Nurses on the Global Sepsis Alliance and has been awarded fellowship in the Australian College of Nursing for her work. We are so pleased to have you join us in the Academy. John P. Daly. Dr. Daly is a global leader in nursing. He is head of the World Health Organization Collaborating Center for Nursing, Midwifery, and Health Development at the University of Technology in Sydney, and past chair of the Global Alliance for Leadership in Nursing Education and Science. We are so pleased to have you join us in the Academy. Patricia M. Davidson. Dr. Davidson has been professor of cardiovascular and chronic care at the University of Technology in Sydney, but this summer she became dean at the Johns Hopkins University School of Nursing. Her program of research focuses on chronic cardiovascular disease and heart failure and their global implications. Welcome to the American Academy of Nursing. Cynthia Marie Stuhlmiller. Cynthia Stuhlmiller is a pioneer in the treatment of post-traumatic stress disorder, developing the first National Center for PTSD in Menlo Park, California in the 1980s. She has extensive experience in designing and leading community participation projects, most recently developing an interprofessional clinic in an underserved Indigenous rural community in New South Wales. We are pleased to have you join us in the Academy. Patricia Yates. Patsy Yates is an internationally recognized leader in cancer and palliative care, whose work has benefited patients, families, policymakers, and nursing. She has conducted numerous large-scale trials to improve symptom outcomes, served on key national boards, and developed innovative teaching approaches that have been adopted nationally. Welcome to the Academy.
From the state of California, yes, Nancy Teresa Blake. Dr. Blake is a nationally recognized expert on healthy work environments and pediatric disaster preparedness. She helped to establish standards for pediatric disaster preparedness at the local, state, and federal levels, including the U.S. Center for Disease Control and Prevention. Welcome to the Academy. Jill E. Borman. Dr. Jill Borman has conducted federally funded research on health outcomes and symptom management in groups such as veterans with chronic illness and PTSD and adults living with HIV/AIDS. The impact of her research on the lives of veterans with PTSD was recently highlighted on local and national television. We're pleased to have you in the Academy. Mary P. Cadogan. Dr. Cadogan is a national leader in gerontology. Her research has focused on improving the quality of care for older adults in nursing homes, including care at the end of life and transitional care experiences of older adults in the emergency department. Welcome to the Academy. No? It's Cadogan. Excuse me. It's Dr. Cadogan, not Cadogan. Cadogan. Thank you. Sorry, Cadogan, I'll get away. Janine K. Cataldo. Dr. Cataldo's groundbreaking work has focused on the impact of tobacco industry activities on older smokers, symptom management of older persons with cancer, and the relationship among lung cancer stigma and quality of life. She developed the Cataldo Lung Cancer Stigma Scale that has been translated into 4 languages and is being used in 9 countries. Welcome to the Academy, Dr. Cataldo. Congratulations. Mary E. Foley. Yes. Dr. Foley is a leader in quality and safety for healthcare workers and patients, a past president of the American Nurses Association and National Student Nurses Association. She has served on the board of the National Patient Safety Foundation and is chair of the Safe in Common campaign to reduce needle stick injuries. Welcome to the Academy, Mary. Thank you. Judith Lynn Martin Holland. Dr. Martin Holland is a pulmonary clinical nurse specialist and family nurse practitioner who is focused on patient advocacy and professional nursing practice. As the first president of ANA California and working closely with specialty nursing organizations on statewide workforce initiatives, she has strengthened nursing in California and created a model for other states. Welcome to the Academy. Welcome. Thank you. Bethany J. Phoenix. Dr. Phoenix has shaped psychiatric nursing practice worldwide, developing innovative mental health nursing curricular resources, including a mental health toolkit for primary care nurse practitioner faculty. She is the immediate past president of the American Psychiatric Nurses Association, and we are delighted to have her in the American Academy of Nursing. Nancy A. Pike. As a pediatric nurse practitioner and researcher, Dr. Pike has studied the factors that affect emotional and physical health, self-care, quality of life, and clinical outcomes in children and adults with congenital heart disease. We welcome you into the Academy. Rita Sicola. Rita Sicola Scholarship has centered on the care needs of children and young adults with hematological oncology disorders. She served as president of the Association of Pediatric Hematology Oncology Nurses, receiving the association's Writing and Leadership Service Awards. We welcome her into the Academy. Laura Michelle Wagner. Dr. Wagner has focused her scholarship on improving patient safety in nursing homes through adverse event reporting and reducing the use of physical restraints and side rails. She has served and is an advisor to the National Quality Forum on reporting serious events in long-term care facilities, to a Canadian initiative on falls management. We're delighted to have you in the Academy. Now from Canada, yay, Joanne Olson. Dr. Olson has promoted interdisciplinary work between nurses and ministry staff and developed a theory of empathy that guides research and mid-range theory development. She co-founded the Canadian Association for Parish Nursing Ministry to connect faith community nurses and received the Alberta Centennial Medal for distinguished service to fellow Albertans. We welcome you to the Academy. Welcome. From the People's Republic of China, Gui Fangguo. Dr. Gui Fangguo is a global leader in nursing, having served on the World Health Organization's Global Panel of Nursing Experts Committee. Previously the vice president of the Chinese Nursing Association, She is also a researcher who has studied the care of frail elders, and we are delighted to have you in the Academy. Shuhua Li, and you'll correct me if I got that wrong. Dr. Li is the president of the Chinese Nursing Association. Under her leadership, the association participated in the International Council of Nurses in 2013 and was accepted for membership in the International Council of Nurses for the first time. Yes. She has worked closely with the Chinese government to develop policies that are strengthening its nursing workforce, and we welcome you to the Academy. Thank you.
Each year, the Academy's board receives nominations for honorary fellowship. These fellows are professionals who've made outstanding contributions to nursing and healthcare, but would not qualify for membership as fellows because they are not nurses. This year, the board has selected 4 individuals for this honor, and our first honoree is Carolyn M. Clancy. Few healthcare leaders are true game changers with substantive impact on the nation's health. Dr. Carolyn Clancy is one. This industry leader has appeared on Modern Healthcare's list of the 100 most influential people in healthcare 10 times, and last year was listed as number 12. Since 1990, she has worked at the Agency for Healthcare Research and Quality, or AHRQ, and served as its director for the past 10 years, stepping down recently from that role to become the Assistant Deputy Undersecretary for Health for Quality, Safety, and Value for the Department of Veterans Affairs. While at AHRQ, Dr. Clancy directed the development of the groundbreaking congressionally mandated annual report on healthcare quality in America. Her vision to drive meaningful change in care quality and safety has shaped local, state, and national policies and serves as a key reference point for this country. Her commitment to safe, quality care has been unyielding and has always included nurses as a foundation. Through her work and platform at AHRQ, it's hard to hear about yourself, isn't it? But I must go on. Through her work and platform at AHRQ, Dr. Clancy has been a consistent voice for the inclusion and power of nursing in reducing healthcare disparities and improving safety and quality of care. Under her leadership, the agency has funded nursing research, supported consistent membership of nurse scientists on the AHRQ National Advisory Council, review committees, and as members of the AHRQ staff, and has actively urged colleagues and other leaders to include nurses in key decision-making bodies. As a colleague noted, behind closed doors and in the public, she has called on the expertise of nurse scientists and the entire nursing profession to improve safety and care quality. Dr. Clancy is a graduate of Boston College and the University of Massachusetts Medical School. She is an elected member of the Institute of Medicine, a master in the American College of Physicians, and in 2009 received the prestigious William B. Graham Prize for Health Services Research for fostering improved quality of care. Because of her commitment and leadership to improve the safety and quality of care, and for highlighting the valued and vital role that nurses play in that goal, we welcome Dr. Clancy into the Academy as an honorary fellow. Welcome. The next fellow to be inducted comes from the state of Colorado, Sharon Pappas. Dr. Pappas is responsible for nursing practice across Centura Health's 14 hospitals, senior care, and home care agencies. She has shaped state and national policies as a member of the Colorado Board of Nursing, the Governor's Task Force for Nurse Staffing, and as a board member for the Colorado Center for Nursing Excellence and the American Organization of Nurse Executives. Welcome to the Academy. From the state of Connecticut, Margaret Flinter. Dr. Flinter is the founder and director of the Weitzman Center for Research and Innovation in Community Health and Primary Care at the Community Health Center Incorporated in Connecticut. She is the national co-director of the Robert Wood Johnson Foundation's Primary Care Teams Learning from Effective Ambulatory Practices, which is a national effort to identify and learn from innovative roles in primary care. We are so pleased to have you join us in the Academy. Renee Manwaring. Dr. Manwaring blends care for children with acute and chronic pain with research to improve pediatric pain management. She is a member of the Child Kind International Board of Directors and the only nurse on the board of the American Pain Society. We are so pleased to have you join us in the Academy. Leslie Neal Boylan. Leslie Neal Boylan's two-pronged program of research has shed light on the stages through which the home health nurse must pass to develop autonomy in the role and the pervasive discrimination faced by registered nurses with physical or sensory disabilities. We are so pleased to have you join us in the Academy. From the state of Delaware, Carlton Brown. Carlton Brown is a dedicated and decorated Army Nurse Corps veteran and oncology nursing leader, having served as president of the Oncology Nursing Society and the Oncology Nursing Certification Corporation. An expert in cancer symptom management, he is the author of 2 award-winning books on the topic. We are pleased to welcome you into the Academy. From the District of Columbia, Janice Blair Griffin Agazio. Dr. Agazio retired after 22 years of service in the Army Nurse Corps in 2000 before entering academia. Her research focuses on military nursing care delivery, the impact of military life upon families, and the ethical issues in wartime nursing practice. We are so pleased to welcome you into the Academy. Diane Seibert. Dr. Seibert has been a leader in genetics and genomics, establishing international provider competencies and research priorities, and in developing GeneFacts, an open access online genetics resource that provides rapid and accurate genetic information at the point of care. Welcome to the Academy. Kimberly Siniskulke. Major General Siniskulke is the Assistant Surgeon General of the Medical Force Development and Nursing Services. She transformed aeromedical evacuation and critical care air transport, resulting in safe movement of over 98,000 injured service members. She has served on the White House Task Force for Veterans and as the Department of Defense's clinical lead for interagency care coordination for wounded warriors. We are so pleased to have you join us in the Academy. Lynn Slepsky. Dr. Slepsky has been an integral part of national and international health and security policy, including emergency planning and response and improving disaster workforce capacity through her work at the Departments of Health and Human Services and Homeland Security, and also at the Department of Transportation, where she serves as the Senior Public Health Advisory to the Secretary. We are so pleased to have you join us in the Academy. From the Republic of Finland, Kaija Saranto. Dr. Saranto launched the first master's program in health informatics in Finland, the first to be accredited by the International Medical Informatics Association. She was president of the Association of Common European Nursing Diagnosis, Interventions, and Outcomes, and co-directs the Finnish Center for Evidence-Based Healthcare. Welcome to the American Academy of Nursing. From the state of Florida, Hilda Alcindor. In the devastating aftermath of the 2010 earthquake in Haiti, Dean Hilda Alcindor and her students provided emergency and ongoing care for thousands of victims and were responsible for the safe birth of dozens of babies. For her efforts, she received an honorary doctorate from the Episcopal University of Haiti. We are so pleased to welcome you to the Academy. Linda Clark Amankwa. Dr. Amankwa has been a leader in distance education. She is an expert in maternal child health and the creator of the Maternal Infant Responsiveness Instrument, a tool currently used in many countries around the world. Welcome to the Academy. Jacinto Jose Garrido. Jacinto Garrido is a global healthcare consultant who created a unique special medical operations unit for aviation, tactical, and shipboard medicine at the request of the U.S. Immigration and Customs Enforcement Agency. He was recognized by the Assistant Secretary of Health and the U.S. Surgeon General for this successful program. We are so pleased to have you in the Academy. Marilyn Ann Ray. Colonel Ray served for more than 30 years in aerospace nursing administration, practice, and research in the U.S. Air Force Reserve Nurse Corps. Her scholarship on transcultural caring and ethics in complex organizations led to her own theory of bureaucratic caring. Welcome to the Academy. From the state of Georgia, Barbara Jean Patrick Blake. Dr. Blake's work has significantly improved the lives of people with HIV. She has worked with state and local agencies to evaluate HIV prevention and care services, address gaps in services, and recommend strategies to improve HIV-related programs and policies in Georgia and other states. Welcome to the Academy. Marilyn Ann Bocut. As a member of the American Hospital Association's Unified Healthcare Policy Team, Marilyn Bocut has substantially shaped healthcare reform. She also served as president of the American Organization of Nurse Executives and led the expansion of the guiding principles for future patient care delivery models. We are so pleased to have you in the Academy. Laura Caramonica. Laura Caramonica is internationally known as a skilled nursing leader. She also served as president of the American Organization of Nurse Executives for 2012 and is a fellow in the American Academy of Healthcare Executives. We are so pleased to have you join us in the Academy. Elizabeth Corwin. Through her research, Dr. Corwin has helped to reduce health disparities by providing a better understanding of the bidirectional contributions of inflammation and chronic stress to adverse pregnancy outcomes, especially among low-income and minority populations. Her textbook of pathophysiology has been used to educate thousands of students worldwide. We so welcome you into the Academy. Christy Keel Martin. Dr. Martin's vanguard research with at-risk adolescents has provided a clinical tool that improves adolescent awareness and actions related to unprotected sex. Her policy work and partnerships with medicine and industrial engineering have also influenced nurse practitioner education and practice. Welcome to the Academy. Martha Smith-Tengen. Dr. Smith-Tengen serves in the Georgia Prevention Center. a multidisciplinary unit of scientists addressing important public health issues. She is co-director of the Child Health Discovery Institute, a research institute that forges collaboration between practitioners and scientists for improving the health of children in the southeastern United States. We are so pleased to welcome you to the Academy. Judith Lupo Wold. Dr. Wold directs the Farm Worker Family Health Program for Emory University's Lillian Carter Center for Global Health and Social Responsibility that has provided health care to 12,000 farm workers and their children since 1993. In 2012, the Carnegie Foundation for the Advancement of Teaching named her the Georgia Professor of the Year. Welcome to the Academy.
From the state of Hawaii, Christine Qureshi. Dr. Qureshi represents Hawaii on the American Pacific Nursing Leaders Council, serves as a technical advisor to the World Health Organization Western Pacific Regional Office, and works with the Pacific Island Health Officers Association to build capacity for quality care in the U.S. affiliated Pacific Islands. Welcome to the Academy. From the state of Illinois, Martha Dewey Berggren. Dr. Berggren develops and disseminates the evidence that school nurses are a cost-effective and prudent investment in the health of our nation's children. A fellow in the American School Health Association, she is chair of the American Public Health Association School Health Education and Services section. We are delighted to have you in the Academy. Constant Miles Dallas. Dr. Dallas's research examines negotiating fatherhood roles in non-traditional families, including conducting the first longitudinal study of African American adolescent fathers. Her leadership in the University of Illinois' Institute for Research on Race and Public Policy has contributed significantly to policy development on health inequities. We are delighted to have you in the Academy. Congratulations. Holly Duvon. Dr. Duvon's research focuses on gender variations in coronary heart disease. She is the principal investigator of the Think Symptoms Study, a multi-site study examining the impact of gender on symptom characteristics during acute coronary syndromes. We are delighted to have you in the Academy. Gail M. Keenan. Dr. Keenan is a leading researcher in nursing informatics and implementation of standardized nursing terminologies, usability, and nursing effectiveness. She has produced the innovative web-based software program HANDS and a database. Recognizing the pathfinding nature of her work, the World Health Organization awarded her the inaugural Founders Award. We are delighted to have you in the Academy. Sue Penkoffer. Dr. Penkoffer's work has focused on diabetes, including depression, the role of vitamin D, and how emotions can affect overall health and quality of life. Her work has increased our understanding of key health issues that disproportionately affect women in minority and underserved populations. Welcome to the Academy. F. Patrick Robinson. Dr. Robinson has a distinguished record of service to the HIV/AIDS care community. He developed and ran an HIV technical assistance program for colleges of nursing in Thailand, and in 2010 was awarded the Lifetime Achievement Award from the Association of Nurses in AIDS Care. We are delighted to have you in the Academy, Patrick. Mona M. Chattel. Mona Chattel is an international expert on inpatient psychiatric mental health nursing practice and one of the few United States-based researchers studying inpatient psychiatric nursing. Her current research focuses primarily on the mental health of vulnerable populations and mental health treatment environments. Welcome to the Academy. Welcome. Nancy Spector. Dr. Spector is a nationally known leader in regulatory issues in nursing education, leading initiatives on the regulatory implications of social media and the regulatory issues in distance learning programs. She is the principal investigator on a multi-site randomized study of new graduates' transition to practice. Welcome to the Academy, Dr. Spector. Welcome. Yes, welcome. Shannon N. Zank. Dr. Zank's work centers on social determinants of obesity and effective policies to eliminate obesity. Her multi-site studies have documented the poor access to healthy foods in low-income, mostly African-American neighborhoods, as well as the impact of the environment and psychosocial stress on obesity-related behaviors. We are delighted to have you in the Academy. From the state of Indiana, Mary E. Reiner. Dr. Reiner has provided leadership in creating international and interprofessional teams to improve nursing capacity and access to health care in countries such as Liberia, Monrovia, and Latin America. Dr. Reiner demonstrates a unique ability to create sustainable academic practice community partnerships that span cultures and improve health care. Welcome to the American Academy of Nursing. Jackie S. Rolls. Jackie Rolls is a leader in anesthesia care, having served as president of the American Association of Nurse Anesthetists. She is now the U.S. representative and first vice president of the International Federation of Nurse Anesthetists and treasurer of the American Academy of Pain Management. We are delighted to have you in the American Academy of Nursing. Welcome. From the state of Iowa, Patricia Clinton. Dr. Clinton is a leading pediatric nurse practitioner who has served as president of both the National Membership and Certification Organization for Pediatric Nurse Practitioners, where she worked with the Society of Pediatric Nursing to develop a unified scope and standards for pediatric nursing. We are delighted to have you join us in the Academy. Sue E. Gardner. Dr. Gardner's research has advanced the care of individuals with chronic wounds, creating evidence for best practices in defining infection in chronic wounds and determining the bioburden of wounds, work that has been extensively cited in the interdisciplinary wound care literature. Welcome to the American Academy of Nursing. Sue Ann Moorhead. Throughout her career, Dr. Moorhead has worked to advance nursing through the development and dissemination of standardized nursing terminologies. As director of the Center for Nursing Classification and Clinical Effectiveness, she has helped to foster worldwide consensus among nurses in advancing nursing's contributions to healthcare. We welcome her to the American Academy of Nursing. Barbara Rakel. Dr. Rakel has made significant contributions to the science and practice of reducing movement pain for older adults using non-drug strategies, such as transcutaneous electrical nerve stimulation. She was also a pioneer in research utilization and evidence-based practice. We welcome you into the Academy.
From Japan, Tetsuya Tanioka. Dr. Tanioka specializes in integrating science and technology within nursing as a caring profession. He is pursuing innovative approaches to blending technology and caring through the use of robotics in research and practice, and in designing a patented and trademarked electronic nursing management system. We are so pleased to have you join us in the Academy. From the state of Maryland, Jason Edward Farley. Dr. Farley's research focuses on HIV and associated co-infections. In South Africa, Dr. Farley developed and is expanding the world's first program for nurse-led models of care for multi-drug resistant TB. He is co-director of the clinical core within the Johns Hopkins Center for AIDS Research. We are so pleased to have you in the Academy. Karen Kaufman. Dr. Kaufman is founder and president of Life Passages Care Consultants that provides long-term care consultation for older adults and families, most with Alzheimer's disease. She served on the U.S. Senate Special Committee on Assisted Living, is a member of the Advisory Council on Quality Care at the End of Life, and the only nurse on the Alzheimer's Association National Board of Directors. Welcome to the Academy. Margaret Mary McNeil. As the first ever Air Force Critical Care Master Clinician and the Air Force Surgeon General's Consultant for Critical Care Nursing, Dr. McNeil helped establish the first joint U.S. medical research team in Iraq and served as senior leader for inpatient operations at the major U.S. military hospital in Afghanistan, achieving unprecedented casualty survival rates. She has received the Bronze Star Medal and the Defense and Air Force Meritorious Service Medals. We are so pleased to have you join us in the Academy. Renee Ann Milligan. Dr. Milligan is a women's health nurse practitioner for vulnerable low-income women and directs the federally funded George Mason PATH project, a nurse-managed faculty practice within a federally qualified health center. Her theory of unpleasant symptoms, co-authored with a colleague, has had extensive influence on nursing theory and research. Welcome to the Academy. Richard P. Ricciardi. Dr. Ricciardi's research focuses on primary care practice improvement in the areas of team functioning, patient and family engagement, and the impact of multiple chronic conditions on healthcare quality and costs. Currently, he is a scientist at the Agency for Healthcare Research and Quality. We are pleased to have you join us in the Academy. Elizabeth Dorothy Sloan. Dr. Sloan is an expert on healthcare in Haiti, where she has worked as a volunteer clinician, educator, and public health researcher for 12 years. She specializes in the health of children who are made vulnerable by their circumstances and is investigating the health effects of bullying. We are so pleased to have you join us in the Academy. Joan Claire Weiss. Dr. Weiss has provided national leadership in developing a diverse and culturally competent health professions workforce. She has shaped policy as Executive Secretary and Chair of the National Advisory Council on Nurse Education and Practice and is the designated federal official for the Advisory Committee on Interdisciplinary Community-Based Linkages. Welcome to the Academy. From the Commonwealth of Massachusetts, Gordia Bannister. Dr. Bannister promotes interdisciplinary research, education, and clinical practice and strives to create an exemplary practice environment for nurses and other health professions. She received the American Nurses Association Mary Eliza Mahoney Award for outstanding achievements in promoting the integration, retention, and advancement of minorities in nursing. We are so pleased to have you join us in the Academy. Patricia A. Branowicki. Ms. Branowicki is an expert in creating innovative infrastructures for the delivery of pediatric care and has facilitated over 25 international consultations, influencing the training of more than 500 nurses in developing countries. She is the nurse leader for building the first pediatric cancer hospital in Mexico. We are so pleased to have you join us in the Academy. Pamela Burke. Dr. Burke is co-director of nurse training for the Leadership Education in Adolescent Health program at Boston Children's Hospital. A seasoned nurse educator, her work exemplifies interdisciplinary collaboration as evidenced by her leadership roles in the Society for Adolescent Health and Medicine and the American Academy of Pediatrics. We are so pleased to have you join us in the Academy. Stephen Kavanaugh. Dr. Kavanaugh has created financially sustainable nurse-managed clinics in both university and community settings. He also pioneered and funded seamless educational models to prepare the next generation of culturally competent nurse practitioners. Welcome to the Academy. Sharon Gale. In collaboration with the Massachusetts Hospital Association, Sharon Gale led the Patient Care Link task force that developed the first national voluntary process and template for reporting hospital staffing plans and quality outcome measures to answer legislators, nurses, and consumers' concerns for safe nursing practice. Welcome to the Academy. Ann Gross. As Vice President for Nursing and Clinical Services at Dana-Farber Cancer Institute and a global nursing leader, Dr. Gross has promoted patient access and interdisciplinary collaboration. In Latin America, she instituted the first health education and nutrition program serving thousands of families across northern Honduras. We are so pleased to have you join us in the Academy. Hyok Yi. Dr. Yi has developed baseline data on hepatitis B virus infection and liver cancer prevention. Her research has been used to develop national health policies addressing health disparities in HBV infection and liver cancer among Asian American Pacific Islanders. Welcome to the Academy.
For a second year, the Academy honors a couple, Barbara and Donald Jonas, who together they have engaged in significant personal philanthropic efforts to enhance nursing and mental health services. Barbara earned her Master of Social Work degree from Yeshiva University and was a practicing psychotherapist. She has given generously of her time, serving on many boards and commissions focused on mental health and well-being. One key organization has been the Community Services Board of the New York City Department of Mental Health, where she served as its vice chair. She also serves on numerous local art and theater foundations. Donald, a prominent retail executive, was founder and chairman of the Barbara Lynn Stores and its successor, Bell Scott Retailers. He was also co-founder and chair of the Lectors Housewares retail chain. He too serves on various educational and health foundations. Barbara and Donald Jonas are passionate and noted art collectors, amassing works by de Kooning, Rothko, Gorky, and Klein. With a desire to improve healthcare during their lifetimes, they sold 15 pieces of artwork, which generated $44 million to seed the Barbara and Donald Jonas Family Fund. That fund it gets better. That fund, in turn, helped establish the Jonas Center for Nursing Excellence, a first-of-its-kind philanthropic program dedicated to advancing the nursing profession. Since 2006, the Jonas Center has leveraged more than $22 million towards nursing scholarships and leadership programs, and $25 million to address the nursing faculty shortage by funding the education of 1,000 doctoral students by 2020. And there's more. Last year, the Jonas Center launched the Jonas Veterans Health Program to address the physical and mental health of military veterans. Because of their philanthropic efforts to improve nursing and mental health services with programs that are touching nurses, nursing students, patients, families, and veterans throughout the United States, the American Academy of Nursing is incredibly proud to welcome Barbara and Donald Jonas as honorary fellows. I'm proud to say they're from my city, New York City. Now, the next group of fellows come from the state of Michigan. Judith E. Fry McComish. Dr. Fry McComish is a renowned expert in infant mental health. Her work has led to improvements in substance abuse treatment for pregnant and parenting women, in care for women with inadequate prenatal care, and those with perinatal depression. We welcome you into the American Academy of Nursing. Carla J. Groh. A certified psychiatric nurse practitioner, Dr. Groh is the project director for a nurse-managed primary care clinic in Detroit for low-income adults. Her scholarship is focused on the interconnections among race, gender, and socioeconomic status, and its impact on women's mental health. Welcome to the American Academy of Nursing. Mary Munt. Dean Munt has spearheaded a number of innovative initiatives, including a community-wide, federally funded intervention to improve cancer nursing care, and convened a statewide conference for academic clinical partners on quality and safety that is being replicated in other states. We are delighted to have you in the American Academy of Nursing, Mary. Stephanie Myers-Shim. Dr. Shim has developed theory, constructed tools, and conducted research regarding cultural competence with an emphasis on end-of-life and palliative care. Her cultural competence assessment instrument has been used by diverse settings and disciplines in 45 states, Puerto Rico, and 18 foreign countries. Welcome to the Academy. Gwen K. Wyatt. Dr. Wyatt conducts research on cancer, including a National Cancer Institute study on improving quality of life for women with advanced breast cancer, cancer symptom management, and chronic fatigue in breast cancer survivors. Her research has shaped practice nationally and internationally, and we are delighted to have you in the American Academy of Nursing. From the state of Minnesota, Sue Sendelbach. Dr. Sendelbach is a leader among clinical nurse specialists. For example, she was president of the National Association of Clinical Nurse Specialists, co-chaired the organization's task force on the development of DNP CNS competencies, and helped to establish guidelines for CNS education. Welcome to the American Academy of Nursing, Sue. Renee Evangeline Sieving. Dr. Sieving's work with marginalized populations of youth emphasizes protective factors rather than focusing solely on risk. Her studies are groundbreaking, such as one to reduce sexual risk, violence, and failure among urban adolescent girls, and one to improve school engagement to reduce bullying among poor middle school students. Welcome to the Academy. From the state of Missouri, not Missouri, it's Missouri. State of Missouri, Maite Enriquez. Dr. Enriquez's scholarship has focused on enhancing health outcomes for underserved low-income individuals of color and individuals with HIV disease having difficulty adhering to their antiretroviral treatment. As an educator, she has enhanced the academic success of disadvantaged students, including low-income students and first-generation college students. We welcome you to the American Academy of Nursing. Welcome. Thank you. Ellen M. Harper. As a nurse informatician and vice president of Cerner Corporation, Dr. Harper has integrated technology and informatics to automate evidence-based, interdisciplinary, patient-centered workflows. Her work has improved the performance of healthcare organizations ranging in size from single doctor practices to health systems to entire countries. Welcome to the Academy. Welcome. Bunny J. Pozel. Dr. Pozel has worked to improve the functioning and quality of life of heart failure patients. Her research was among the first to improve adherence to moderate intensity exercise guidelines in heart failure. She has provided leadership in the American Heart Association and the Heart Failure Society of America, and we're delighted to have her in the American Academy of Nursing. Welcome. From the state of New Jersey, Robert L. Atkins. Dr. Atkins is the program director of the Robert Wood Johnson Foundation's New Jersey Health Initiatives Program, the foundation's signature statewide grant-making program. Through his scholarly work and practice, Dr. Atkins has shaped the policy and practices that influence the well-being of vulnerable populations in poor neighborhoods. Welcome to the American Academy of Nursing. Janice M. Bites. Dr. Bites has taught, practiced, conducted research, and shaped policy in wound, ostomy, and continence care. For her work, she was awarded the Master of Wound Care Award of the American Professional Wound Care Association, one of only a handful of providers in the country to receive this distinct honor. We welcome her into the American Academy of Nursing. Welcome. Jeannie P. Simiotti. Dr. Simiotti was the first nurse researcher to link nurse workload to healthcare-associated bloodstream infections in premature infants in the neonatal intensive care unit, and to catheter-associated urinary tract infections and surgical site infections in hospitalized adults. We are delighted to have you in the American Academy of Nursing. Cynthia Nowicki-Nadek. Dr. Nowicki-Nadek has promoted the development and engagement of volunteer nursing leaders. She has served as the executive director of myriad national nursing organizations and is past president of the American Society of Plastic Surgical Nurses. We welcome you to the American Academy of Nursing. Sandra Festa Ryan. Sandy Ryan is the Chief Nurse Practitioner Officer and Clinical Advocate for Walgreens Take Care Clinics, leading the growth of these clinics to over 370 nationwide. She is the founder of Take Care Health Systems and a founding board member of the Convenient Care Association, and we are honored to have you in the American Academy of Nursing. Congratulations. Mindy B. Tinkle. During her service at the National Institutes of Health, Dr. Tinkle advocated for innovative research training opportunities and pioneering mentorship models for doctoral students and postdoctoral fellows. She lobbied successfully to increase the presence and voice of nurse scientists in the scientific peer review process. Welcome to the American Academy of Nursing.
From the state of New York, Suzanne Mulvey Boyle. Dr. Boyle has been an innovator in organizational change. Examples of her work include a nurse-led barrier reduction team model to improve patient flow, outcomes, interprofessional collaboration, and operating performance. Her current scholarship centers on work environment and nurse-sensitive patient outcomes. Welcome to the Academy. Bernadette Curry. Throughout her career as a nurse educator and dean, she has focused on advancing quality education and practice. As the founder of the New York Consortium for Men in Nursing and an active member of the American Assembly for Men in Nursing, she has been a staunch advocate for the contributions of all in nursing. Welcome to the Academy. Georgia Decker. Georgia Decker is founder and nurse practitioner of Integrative Care, a private nursing practice that provides counseling for evidence-based complementary and alternative therapies. She served as president of the Oncology Nursing Society and has advanced health policies that improve access to cancer symptom management. We are so pleased to have you in the Academy. Joyce Griffin Sobel. Dr. Griffin Sobel is an innovator in the use of technology in nursing education. She created the NYC Nursing Education Consortium in Technology and partnered with a colleague at Weill Cornell Medical College to build a funded program of interprofessional education. Welcome to the Academy. Marcia Lewis. Dr. Lewis's research and academic leadership have significantly improved the quality of care for older adults and their family members. As one example, she developed the Savvy Caregiver Program, a research-based intervention for family caregivers of persons with dementia, which has been implemented in 15 states and internationally. We are so pleased to have you join us in the Academy. Diane Cooney-Miner. Dr. Cooney-Miner is a national and international leader in nursing education and in the movement to require nurses to have a baccalaureate degree within 10 years of their initial licensure. She is the U.S. representative on an initiative to standardize nursing education in the European Union. We are so pleased to welcome you to the Academy. Anita Nierenberg. Dr. Nierenberg developed new models of oncology care by developing the first pediatric and adult day hospital for ambulatory treatment of cancer patients. Her landmark study of emergency department waiting times for patients with chemotherapy-induced neutropenia resulted in national practice changes. Welcome to the Academy. James Pace. James Pace is a national leader in palliative care. His evidence-based advanced practice protocols in palliative care are used by advanced practice nurses in over 30 states. He has also designed models for HIV/AIDS care delivery in prisons and nurse practitioner managed clinics. We are so pleased to welcome you to the Academy. Ronaldo Rivera. A past president of the Philippine Nurses Association of America, Dr. Rivera has advocated for ethical recruitment practices and the rights of disenfranchised foreign nurses. He has participated in global forums on migration and development and served on the board of the Alliance for Ethical International Recruitment Practices. We are so pleased to welcome you to the Academy. Susan Sullivan Boya. Dr. Sullivan Boya is a nurse scientist who has worked clinically with children who have special health care needs and their families. She has conducted research on the preparation, education, and support for families to help them manage their children's care in the home and community settings. Welcome to the Academy. Lily Thomas. Dr. Thomas is responsible for developing nursing research, facilitating evidence-based innovations, and building a culture of inquiry in a 16-hospital health system of 11,000 nurses. She was appointed to the inaugural steering council of the National Improvement Science Research Network. We are so pleased to have you join us in the Academy. G. Ramey Alexander. Dr. Alexander's passion for equity of opportunity and individual growth has led to appointments on landmark initiatives including the American Hospital Association's Commission on Workforce for Hospitals and Health Systems and the National Quality Forum's Steering Committee for the first national voluntary consensus standards for nursing sensitive care. We are so pleased to welcome you into the Academy. Patricia T. Campbell. A passionate advocate for women and children's health, Patricia Campbell developed the first lactation center and postnatal screening process to detect maternal depression. She has served on the board of directors for the March of Dimes, Ronald McDonald House, and Community Free Clinic. We are so pleased to welcome you to the Academy. Denise Cote Arsenault. Dr. Cote Arsenault is a pioneer in examining the experiences of families with perinatal loss. Her funded research has described the tentative emotional investment that women make in pregnancies after loss and what it means to assign personhood to a fetus. Welcome to the Academy. Sharon Lee Doherty. Dr. Doherty's research focuses on the impact of life-threatening illness on the functioning of acute and chronically ill children and their families. She has served on the National Quality Forum's Child Health Outcomes Committee and the Technical Advisory Panel for the National Evaluation of the Children's Health Insurance Program Reauthorization Act Quality Demonstration Grant Program. Welcome to the Academy. Carol Fowler Durham. As a visionary leader in practice-based education, Dr. Durham has made sustained contributions to simulation-based and interprofessional education and integrating quality and safety into curricula. She is president of the International Nursing Association for Clinical Simulation and Learning. We are so pleased that you are joining us in the Academy. Martha Keener Engelke. Dr. Engelke has created academic and service partnerships to address health problems in underserved rural areas. She has also promoted the key role of school nurses in the health and well-being of children with a chronic illness, receiving an outstanding research award from the National Association of School Nursing. Welcome to the Academy. Michael Riker. Dr. Riker is an international leader in nurse anesthesia. A proponent of global health education, he has been involved for 7 years in a maternal child project in Ghana, and he developed a global study program for anesthesia students. Welcome to the Academy. Suzanne Marie Thorey. Dr. Thorey advanced our understanding of the challenges preterm infants face when they are learning to feed by mouth. She developed innovative observational methods to examine infant behaviors during feeding and has translated the science of early oral feeding to professional and lay caregivers. We are so pleased to have you join us in the Academy. Michael E. Zykowitz. Dr. Zykowitz is a national leader in orthopedic nursing. He is the lead faculty for the only orthopedic nurse practitioner specialty program in the United States and has received a number of honors for his work, including the American Academy of Nurse Practitioners Award for Excellence. Welcome to the Academy.
From the state of Ohio, Claire C. Caruso. Dr. Caruso's research was among the first to clearly present the evidence linking long work hours to health and safety risks and is used by the Joint Commission, regulatory agencies, labor, and industry to set their recommendations and position statements. Welcome to the American Academy of Nursing. Pamela Dickerson. Dr. Dickerson is chair of the American Nurses Credentialing Center's Commission on Accreditation and has advanced nursing by removing legislative barriers to practice and by operating 2 successful nursing businesses. Her work with the Alliance for Continuing Education in the Health Professions is shaping competency development for all disciplines. Welcome to the Academy. Yes. Margaret O'Brien Doheny. Dr. Doheny's research has made an impact on orthopedic nursing and osteoporosis prevention, with a focus on risk behaviors and health-promoting interventions. She was one of the first nationally recognized nurse researchers to study bone health in men, and we're delighted to have her in the American Academy of Nursing. Paula Irwin Toth. Paula Irwin Toth is internationally known as an author, lecturer, researcher, and patient advocate who is dedicated to improving the care of people with wounds, ostomies, and incontinence. In 2012, she was awarded the Lifetime Achievement Award by the Wound, Ostomy, and Incontinence Nurses Society, and we're delighted to have you in the American Academy of Nursing. I'm going to take that back. That is Paula Irwin Toth.
Thank you so much.
Jill Francesca Nadolny Kilinowski. Dr. Kilinowski's research focuses on health promotion of the Latino children and families of migrant farm workers. She serves on the United States Health Resources and Services Administration's National Advisory Council on Migrant Health and on the board of the Ohio Professional Society on the Abuse of Children. We welcome you into the American Academy of Nursing. Welcome. Marie J. Lotus, an innovative educator with a passion for global impact. Dr. Lotus developed an extensive undergraduate international program that includes semester-long study abroad opportunities and reciprocal exchange programs for international students. This program has developed partnerships spanning 5 continents and the Caribbean islands. Welcome to the Academy. Marie Quinn Griffin. Dr. Griffin is an internationally recognized expert in genomics education for nurses. She has provided leadership to the International Society of Nurses in Genetics and published and presented widely on issues related to genetics education and ethical issues in genetic research. Welcome to the American Academy of Nursing. Sharon A.R. Stanley. Dr. Stanley is a senior health policy and planning leader at the American Red Cross and its chief nurse, providing leadership for 15,000 Red Cross nurses. She served 34 years in the Army Nurse Corps and was the first commander of several units, including a brigade-level command. We welcome you to the American Academy of Nursing. Welcome. From the state of Oregon, Susan Bakewell Sachs. Dr. Bakewell Sachs has been a leader in pediatric nursing and workforce development. She was in New Jersey till recently, where she led the New Jersey Nursing Initiative, a multi-million-dollar Robert Wood Johnson Foundation program based at the New Jersey Chamber of Commerce, aimed at assuring that New Jersey has the nursing faculty and workforce needed to meet the future healthcare demands. Welcome to the American Academy of Nursing. Congratulations. Tracy A. Klein. Dr. Klein is a policy analyst for advanced practice at the Oregon State Board of Nursing with expertise in nursing regulation. She is vice chair of the Oregon Pharmaceutical and Therapeutics Committee, appointed by the Oregon Office of Health Policy after 10 years of service on Oregon's Medicaid Formulary Advisory Committees. We're delighted to have you in the American Academy of Nursing. Welcome. Thank you. Gary Lawson. Dr. Lawson is an advanced practice nurse practitioner educator, and researcher with an expertise in rural health. His advanced clinical practice has been devoted to serving vulnerable populations in clinics, emergency departments, and university health centers. He received the American Academy of Nursing's Oregon State Award for Excellence. Welcome to the American Academy of Nursing. Welcome. From the Commonwealth of Pennsylvania. This is now about to get rowdy. Kathleen Burke. Dr. Kathy Burke is a leader in professional development and innovation. She provides strategic leadership for nursing professional development, education, and innovation for the Penn Health System and serves as Assistant Dean for Clinical Nurse Learning and Innovation at the Penn School of Nursing. We welcome you to the American Academy of Nursing. Pamela Z. Cascione. Dr. Cascione is a practitioner at the University of Pennsylvania School of Nursing's Living Independently for Elders, or LIFE, program, where she has created a learning laboratory for integrated mental health care for dual-eligible older adults with a special emphasis on sensory impairment. We're delighted to have you in the American Academy of Nursing. Congratulations. Mary Ellen Smith Glasgow. As a driver of innovation, Dr. Glasgow has developed many nursing education programs that embrace technology and transdisciplinary models of simulation. She co-authored a position paper for the Institute of Medicine's landmark Future of Nursing report with the recommendations on innovative educational models incorporated into the final report. Welcome to the American Academy of Nursing. Beverly Cosmac Park. An international leader in transplant, Dr. Cosmac Park served as chair of the American Society of Transplantation's Community of Allied Health Professionals, as president of the International Transplant Nurses Society, and in leadership roles for the American Transplant Congress. Welcome to the American Academy of Nursing. Mary Lou Manning. Dr. Manning is an expert in infection prevention and control. She serves on several boards, including the Association for Professionals in Infection Control and Epidemiology, and was appointed to the World Health Organization's Global Infection Prevention and Control Network Curriculum Work Group. Welcome to the Academy. Welcome. Denise Murphy. Denise Murphy is another leader in infection control, having received the Carol DeMille Lifetime Achievement Award for Infection Prevention. She was president of the Association for the Infection Control and Epidemiology and served on the National Quality Forum's Patient Safety Advisory Committee and CDC's Healthcare Infection Control Practices Advisory Committees. We welcome you to the American Academy of Nursing. Something was missing there. Thank you. Anne-Marie Papa. Dr. Papa is a national leader in emergency nursing. She served as the president of the Emergency Nurses Association and earned its highest honor, the Judy Callagher Award for Excellence in Emergency Nursing. We're delighted to have you in the American Academy of Nursing. Now, from the Republic of Singapore, Sally Wei Chi Chan. Dr. Chan is an international leader in mental health nursing. She served as a member of the World Health Organization's Primary Care Consultation Group for revision of the ICD-10 mental and behavioral disorders, and is a member of the Hong Kong government's expert group on mental health services to develop the blueprint to reform mental health services for the country. We are delighted to welcome you to the American Academy of Nursing, Dr. Chen. Thank you. Congratulations. Thank you. From the state of South Carolina, Lynn S. Nemeth. Dr. Nemeth's Dr. Nemeth's rich practice background and expertise in quality improvement, patient safety, and outcomes informs a decade of her federally funded research on primary care, preventive services, and practice development using electronic health records. We welcome you to the American Academy of Nursing, Dr. Nemeth. Thank you. My apologies.
I also want to just make a clarification. Someone that we introduced is Marie Lotus is Marilyn. So I wanted to just, as I said, this is so important that we appreciate your correcting us, because you don't want to hear your name on such an important night that's not the way they pronounce it. People call me Joanne Deesh, and it's like, I don't even know who that is. So it's very appreciative that you let us know. Okay, our honorary fellows. For our last category of the night, there is nothing more rewarding than talking with a nursing colleague who loves nursing and clearly sees its importance to the health of the nation. Unless it's talking with a non-nursing colleague who affirms the importance of nursing and uses his or her expertise to eliminate barriers to nursing practice. These people are called allies, and tonight we honor one such ally, colleague and friend, Barbara Safriat. Professor Safriat's extraordinary and sustained contributions to nursing and healthcare are threaded throughout her career in her tireless efforts to remove unjustified barriers to practice that limit public access to qualified, safe healthcare professionals. Beginning in the 1970s, her work on examining health professional practice regulation paved the way for advanced practice nurses to define a scope of practice that would ensure access to safe health care. Her article, Healthcare Dollars and Regulatory Sense, The Role of Advanced Practice Nursing, is a classic, highlighting the consequences of regulatory control by dominant provider groups that excludes certain provider groups and results in underuse and systemic inefficiency in care delivery. These and other legal research projects helped frame the chapter on federal regulation for advanced practice nursing in the IOM study, The Future of Nursing. Professor Safriat served as Associate Dean of Yale Law School, during which time she served as a member of the Pew Commission on the Future of Health Professions, including its task force on healthcare work regulation. In addition, she has served as a health law consultant for numerous prestigious organizations and foundations, such as the Rockefeller Foundation, the W.K. Kellogg Foundation, the Commonwealth Fund, and the U.S. Public Health Service. While serving in these various capacities, Professor Safriat consistently authored multiple legal and policy papers that have had a direct, positive, and sustained impact on nurse practitioner practice and access to health care. She earned a bachelor's degree in economics from Goucher College, a Juris Doctorate with honors from the University of Maryland, and a Master of Law degree from Yale Law School. Currently, she is a visiting professor of health law at Lewis and Clark Law School. Because of her long history of advocating for better regulatory conditions that allow nurses in all roles to provide quality care, we are proud to welcome Barbara Safriat as an honorary fellow of the American Academy of Nursing.
Congratulations.
You said it just right.
I hope.
Continuing from the state of South Dakota, Linda Marie Herrick. Dr. Herrick has made outstanding contributions to evidence-based practice in post-operative pain management, alcohol screening, and functional bowel disorders. As Director of Nursing Research at the Mayo Clinic, she increased the visibility of nursing research on all 3 of its campuses nationwide. Welcome to the Academy. From Taiwan, Shou Min Chai. Dr. Shou Min Chai's research focuses on multi-ethnic women's health. She has facilitated international research coalitions among nurse researchers studying Asian women's health issues through the Asian Women's Health Research Network across the United States, South Korea, and Taiwan, and is an advisor to Taiwan on nursing education. We are so pleased to have you join us in the Academy. Teresa J.C. Yin. Dr. Yin has decisively shaped nursing practice through several senior academic and government positions and established the current framework that guarantees nurses' rights and privileges. She was president of the Taiwan Nurses Association and the first nurse in Taiwan appointed as a commissioner to the Taiwan provincial government. We are so pleased to have you join us in the Academy. From the state of Tennessee, Sarah Williamson Day. Dr. Day's programs have improved the outcomes for underserved children with sickle cell disease and cancer in the United States and in 9 developing countries. She has also empowered nurses in developing countries to provide quality pediatric oncology nursing care and created programs to advance the nurses' work environments. We are so pleased to have you join us in the Academy. Jane D. Engelbright. As Chief Nurse and Vice President at HCA, Dr. Engelbright oversees patient safety and 68,000 nurses in the United States and London. She serves on the National Patient Safety Foundation's Board of Governors and was a member of the Lucian Leap Institute Roundtable on Joy and Meaning in the Workplace. Welcome to the Academy. Francis Estes Likas. Dr. Likas is nationally recognized for advancing evidence-based best practice in women's health and integrating reproductive health into mainstream nursing and midwifery practice. The only nurse on the faculty of the Vanderbilt University Evidence-Based Practice Center, she leads interprofessional teams that conduct systematic reviews on women's health care. Welcome to the Academy. Todd Bryant Monroe. Dr. Monroe's early research focused on substance abuse policies in professional nursing and nursing educational programs. This scholarship has been internationally recognized and adopted by nursing schools, substance abuse treatment centers, and endorsed by the National Council of State Boards of Nursing. We are so pleased to have you join us in the Academy. Congratulations. From the state of Texas, Terry S. Armstrong. Dr. Armstrong is recognized as an international leader in neuro-oncology research and patient care. Her research focuses on symptom and toxicity assessment and the underlying biologic mechanisms. She has developed instruments that now are used in multiple National Cancer Institute designated trials. Welcome to the Academy. Kathleen Miller Baldwin. Dr. Baldwin has promoted linkages between the clinical setting and academia. She served as president of the National Association of Clinical Nurse Specialists. She recently completed work with the Pioneer Accountable Care Organization to develop a case management model using advanced practice nurses to manage complex patients. We are so pleased to have you join us in the Academy. Janie Canty Michelle. Dr. Canty Michelle's distinctive contributions arise from her work in developing several innovative community-based interventions to improve parenting, mental health, and health services for children and adolescents from ethnic minority and underserved population. Her work is helping to reduce health disparities in Texas and the nation. Welcome to the Academy. Mitchell, thank you very much. Let me read it correctly. Thank you. Janie Canty Mitchell. Thank you. Sarah L. Gill. Dr. Gill's career has focused on improving breastfeeding incidence, duration, and exclusivity, especially in vulnerable populations. She is the Director of Research and Special Projects for the International Lactation Consultant Association. Her breastfeeding toolkit, Baby Steps in Texas, helps healthcare providers improve outcomes with their prenatal clients. Welcome to the Academy. Jennifer Gray. For the past 10 years, Dr. Gray has worked with nurse leaders and bedside nurses in Uganda, Tanzania, and Rwanda to increase their research capacity. She has worked with the Ugandan Nurses and Midwives Union to develop a national research committee with research priorities. We are so pleased to have you join us in the Academy. Tracy Culp Harrison. Dr. Harrison's work has focused on people with disabilities, including unemployed workers, racial and ethnic minority groups, and women who are homeless and uninsured. Her research has unearthed a culture of survival across these groups as they cope with repetitive denials for access to care and resources. We are so pleased to have you join us in the Academy. Ellen K. Kintner. Dr. Kintner is the leader of a 160-member multidisciplinary research team implementing the national guidelines for Eileen. Oh, I'm sorry. Can we roll that back a little bit and I will start at the top so that we can. Thank you. Eileen K. Kintner is the leader of a 160-member multidisciplinary research team implementing the national guidelines for asthma management. She developed the acceptance of asthma model and SHARP, or Staying Healthy, Asthma Responsible and Prepared, which is trademarked, an educational and counseling program that has improved asthma control and quality of life. We are so pleased to have you join us in the Academy. Thank you. Susie Lockwood. Dr. Lockwood is a leader in cancer care and research methodology and measurement. She is chair of the Texas Cancer Prevention and Research Institute's Scientific and Prevention Advisory Council and secretary for the National Ovarian Cancer Coalition Board of Directors. Welcome to the Academy. Nora Montalvo Leando. Dr. Montalvo Leando has generated evidence to guide policy and best clinical practices for the thousands of abused women who struggle to survive on the Texas-Mexican border. Her research tests interventions to empower abused women and promote the well-being of children exposed to violence. Welcome to the Academy. Julie Cowan Novak. A global nursing leader, Dr. Novak's work has centered on developing innovative, practical, and sustainable models for both education and practice to assure accessible, high-quality health care for rural and vulnerable populations, from post-Katrina Biloxi to Huachimilco, Mexico, to Cape Town, South Africa. Welcome to the Academy. Linda Radine Rounds. Dr. Rounds is a leader in advanced practice nursing. She was president of the National Organization of Nurse Practitioner Faculty and received its Nurse Practitioner Educator of the Year award. For 12 years, she was the Advanced Practice Nursing Representative and then President of the Texas Board of Nursing. We are so pleased to have you join us in the Academy. Mary Beth Thomas. Dr. Thomas is an independent nursing consultant with expertise in nursing regulation, administration, and patient safety. A champion of professional competency, she served as Director of Nursing Practice and Education for the Texas Board of Nursing and received the National Council of State Boards of Nursing Exceptional Contribution Award. Welcome to the Academy. From the Kingdom of Thailand, Wipada Kunawiktikan. Dr. Kunawiktikan is a global nursing leader. She is the director of the Nursing Policy and Outcome Center, the head of the World Health Organization Collaborating Center for Nursing and Midwifery Development, and the president of Thailand's Honor Society in Nursing and Midwifery. We are so pleased to have you join us in the Academy. From the United Kingdom of Great Britain and Northern Ireland, Mark Hayter. Professor Hayter is an expert in sexual and reproductive health. He is editor of the Journal of Advanced Nursing and has served on several international scientific committees for the Royal College of Nursing International, the International School Nurse Conference, and the World Association of Sexology. We are so pleased to have you join us in the Academy. Penny K. Jensen. Dr. Jensen enhanced the global recognition of nurse practitioners by implementing nurse practitioner-led clinics at the Salt Lake City Olympic Games. She has briefed U.S. congressional officials on the nurse practitioner role in medical homes. Welcome to the Academy. From the Commonwealth of Virginia, Anna C. Alt-White. Dr. Alt-White develops the Veteran Affairs next generation of nurse scientists and connects them to the larger community of nurse scholars. She led a team that developed a multimedia program, I'm a Veteran, Should I Participate in Research?, to help veterans decide whether or not to participate in research studies. We are so pleased to have you join us in the Academy. Congratulations. Mary Ann Birenholt. As an international researcher and expert in rural health, Dr. Birenholt directs the University of Virginia School of Nursing's Rural and Global Health Care Center and the school's engagement in 34 countries. She is part of the National Institutes of Health funded project on water and health in Limpopo, South Africa. Welcome to the Academy. Beth A. Collins Sharp. Dr. Sharp is Senior Advisor for Women's Health and Gender Research at the Agency for Healthcare Research and Quality and former Director of the agency's Evidence-Based Practice Centers, the first nurse to hold these leadership roles and others, including serving as faculty in 2 medical schools and directing OBGYN research programs. We are so pleased to have you join us in the Academy. Congratulations. Paula Rigsby Grayling. Throughout her career, Dr. Grayling has focused on improving patient safety and the competence of team members in achieving quality outcomes during the perioperative experience. She is a past president of the Association of Perioperative Registered Nurses and was instrumental in launching a fire safety toolkit for the perioperative environment. Welcome to the Academy. Donna Jo McCloskey. As a program director at the National Institutes of Health, Dr. McCloskey developed a portfolio of research focused on thrombotic complications of venous access devices and led an NIH National Community Engagement Committee, for which she received an NIH Director's Award. She also received the NIH's Distinguished Nurse Award. We are so pleased to have you join us in the Academy. Karen Muma Rose. Dr. Rose is a leading researcher on the care needed by older adults with Alzheimer's disease and their family caregivers. She is the co-author of a white paper commissioned by the National Alzheimer's Association on the scientific evidence on effective interventions and the needs of individuals with early-stage Alzheimer's. We are so pleased to have you join us in the Academy. Lee Small. Dr. Small's research focuses on the prevention and treatment of overweight and obesity in young children and their parents that has had international impact. She is president of the Association of Faculties of Pediatric Nurse Practitioners. We are so pleased to welcome you to the Academy. Deborah Tansy Zimmerman. Chair of the American Nurses Credentialing Center's Commission on Magnet, Dr. Zimmerman has been a leader in creating national and international workplace education standards and a predictive modeling tool that allows organizational leaders to accurately forecast the impact of policy changes on educational progression of the workforce. Welcome to the Academy. From the state of Washington, Margaret Baker. Dr. Baker's major contributions have been in elder mistreatment and garnering regional, national, and international support for the roles of nurses on interprofessional elder mistreatment teams. She serves as co-chair of the King County Elder Abuse Council in the state of Washington. Welcome to the Academy. Janice E. DeSocio. Dr. DeSocio's innovative educational models and interdisciplinary research address the mental health needs of vulnerable populations, including the experiences of children with anorexia nervosa, nurse home visitation to foster self-agency in adolescent mothers, and the role of school nurses in children's mental health, along with the mental health needs of the military. We are so fortunate to have you join us in the Academy. Marie Drever. Marie Drever is a research consultant who uses inquiry and innovation to promote research-based practice. For example, the U.S.-Russian Research Collaborative generates research proposals for practical implementation, and the Clinical Inquiry Initiative demystifies research among nursing staff and challenges them to apply research to solve everyday clinical problems. We are so pleased to have you join us in the Academy. Joachim Voss. Dr. Voss is a recognized leader in translational research and treatment approaches for fatigue and mitochondrial dysfunction in patients with HIV and other chronic conditions. He has led the development of an evidence-based symptom management guideline covering 12 highly prevalent symptoms and syndromes of people living with HIV. We are so pleased to welcome you into the Academy. Danuta Maria Voyner. Dr. Voyner's research has examined the often unappreciated challenges faced by vulnerable populations, such as detecting intimate partner violence in childbearing women and the experiences of lesbians who miscarry. This latter research resulted in a universal miscarriage model that is guiding international practice and research. Welcome to the Academy. finally, from my home state of Wisconsin, Mary E. Hagel. Dr. Hagel has advanced the safety of patients and improved the quality of nursing practice. As one example, she collaborated with an Infusion Nurses Society team to develop a rating scale that indicates the strength of evidence for practice recommendations and is innovative in acknowledging evidence based on anatomy, physiology, and other regulations. Welcome to the Academy. Nancy Coram. An active leader in her community and nationally, Nancy Coram is president of the Southeastern Wisconsin Juvenile Diabetes Research Foundation, a member of the Milwaukee School of Engineering, School of Nursing Advisory Board, and for 12 years served as a member of the American Lung Association Board of Directors. Welcome to the Academy. Judith K. Payne. Dr. Payne's research focuses on neuroendocrine and inflammation markers in patients with cancer for symptoms such as cancer treatment-related fatigue, sleep disturbances, and depressive symptoms. Her recent work offers the potential to change practice by identifying inflammatory markers and other underlying etiology of cancer treatment-related symptoms and tailoring interventions accordingly. We are so pleased to welcome you to the Academy. Susan J. Zahner. Dr. Zahner's scholarship has focused on improving local health department performance, multi-sector health partnerships, and public health education and practice. She is the chair of the Public Health Nursing Section of the American Public Health Association and was chair of the Board of Health for Madison and Dane County. We are so pleased to welcome you to the Academy. Ladies and gentlemen, it is an honor to present the Fellows of the American Academy of Nursing cohort of 2013. This has been a wonderful celebration of our colleagues' accomplishments, but the night is not over yet. To continue the celebration, there are several receptions hosted throughout the hotel, as well as food and drink just outside this room. We need you to leave because the room is going to be magically transformed within an hour into a totally different scene for our 2013 Academy Soiree, complete with an extraordinary dance band that will entice and excite people of all ages. Please exit the room at this time as expediently as you can, and we'll see you in 1 hour. Thank you.